Dr. Anand, and I welcome you all to this wonderful 5-week course on interviews. You have all done all your good work. You would have, applied for your choice of universities, and hopefully got a good UCAT score. So now the main issue is about how to answer the interviews, and I sincerely wish you all get the interviews for the universities you applied for over the next few months. So in preparation for that, we have been doing these sort of interviews over the last 6 to 7 years, and we have been successful in many people getting help from what we can offer. So the session structure of the session will have 10 minutes of a quick session from Dr. Abhishek, and then you will all be sent to your meeting rooms where you will have time for discussion for about an hour. Our MMI book is almost ready, and we'll be sending you in a few weeks' time. Apologies for the delay and confusion. We learned from our mistakes, and we will start on time next week. Over to you, Abhi.
Good evening, everyone. My name is Dr. Abhi. I will be your presenter for the next ongoing weeks, and hopefully the purpose of these coming weeks is for you to have an understanding of what type of content can be there in your medical interviews. So today we'll be talking about ethics. So I'll just wait for Priya to share, I hope.
Yes, we can see your screen, Abhi.
Perfect. Okay, let me just go to from beginning. Right, okay. I hope you can all see my screen. So this will be a short and sweet course on the many different topics covered in the MMI. Okay, so what is the course plan? The first week, so today, we'll be doing ethical scenarios, then we'll be doing communication skills and role play next week, then teamwork and leadership, managing complex scenarios, and then we're going to be doing data analysis and interpretation in the near future. So hopefully that will be a vast range of different things which we will be covering over the upcoming weeks. So which I'm quite excited for, and can't wait to get through all of this with you. So the learning objective from the 6-week course. So for today is developing ethical decision making. So when you are in your interviews, no one expects you to be the ethical mastermind, but they want you to have a brief understanding of what ethics actually means in, healthcare practice. And we all appreciate the fact that you might not have a lot of exposure, but it's about the intent and the resilience and motivation you've shown towards the course. So for different sessions, we're going to have different learning objectives. And learning objectives are really important because that's what drives the way you study. So lesson 1, which is today, ethical scenarios. Okay. So the purpose of, is it still sharing?
Yes.
Yeah.
Okay, slideshow. Okay, the purpose of today, ethical scenarios, understand the role of ethical scenarios. The objective is, what is the role of ethical scenarios in MMIs? The definition, so the reason of ethical scenarios is to test your ability to reason through moral dilemmas. And these are the dilemmas you might be facing in your day-to-day practice. And we will navigate ourselves through these scenarios using medical ethical principles. The common themes we're going to talk about, which may not be all of the themes, but the most broader themes are patient confidentiality, informed consent, resource allocation, and autonomy versus beneficence. Okay. The first and foremost concept we need to be aware about is the 4 pillars. So what is the 4 pillars of medical ethics? Some of you might have already know about this, you might have read about this. So the 4 pillars of medical ethics, which are basically the founding principle of medical ethics, is autonomy, beneficence, non-maleficence, and justice. So what does autonomy mean? Autonomy means giving the patient the opportunity to make their own decisions and ensuring they have all the information they need to make their decisions and respecting that right. Beneficence, sounds a bit like benefit. So what it means is acting in the best interest of the patient always. Non-maleficence. So if we just break those words apart, means maleficence, harm. So doing no harm. Justice means treating everyone according to the resources we have available and treating people with equity and following all legal laws and medical laws and principles. So why does medical ethics matter? So when we learn something, we need to understand why it matters. So medical ethics, as a newly qualified doctor and people who are doctors, is what guides you in the decision-making process in looking after patients. They ensure patient safety, fairness, equity, and respect in the healthcare environment. So medical ethics isn't just for patients, it's also for the staff members and everyone there in the hospital. And learning medical ethics helps you demonstrate your values as a future doctor. So medical ethics is heavily linked to your situational judgment you may have practiced for in your UCAT. So the common ethical scenarios is we normally have breaking bad news, which could be a role play or could be a discussion. You might have prioritizing patients. So they might give you a scenario. We might go through 1 or 2 of these today. It could be, how would you handle a breach in patient confidentiality, or when would you breach patient confidentiality? And the other one, which is quite difficult, is how to deal with patients who are actually refusing life-saving treatment, because we're going to come across a few terms today, the big C's being capacity and consent. And if a patient has capacity, how can we make sure the patients are making the right decisions for their best interest? Because that's our duty as a doctor. So the framework for approaching these ethical scenarios is, let's first identify the ethical dilemma. So until we understand what's going on, then we can't act and go forward. Let's consider the perspectives for all the parties, the patient involved, the family involved, us as a doctor, our healthcare team, our multidisciplinary team, and the whole healthcare system. We need to recognize what the values and principles are involved, and we need to give a non-biased solution. I'm sure as a human we will have a stance towards this, but we need to ensure that we can give a non-biased solution based on principles and justify your decision to the individuals, to the people around you. And, if questioned by the authorities, what made you take that decision in the first place? Example 1. So a patient might be refusing treatment. They could be refusing to take a blood test. And the patient could be competent. Competent means they have the ability to understand, retain, weigh up, communicate, they have capacity, and they're refusing this treatment. So what are the types of considerations? Well, we need to know autonomy, beneficence. If we go against their wishes, is that non-maleficence? What are the legal principles involved? And the way we go around this is we respect the patient's autonomy, we ensure that they're taking an informed decision-making process, and we need to ensure that they understand that's what the outcomes are. So we're not persuading them, we're not guilt-tripping them, we are scientifically just explaining the process. So there might be a question on resource allocation. the COVID pandemic has happened a few years ago, and in the pandemic, you might have had limited ventilators. How do you decide who gets treatment? Well, we have to go about equity. It's not just about equally, it's about who needs it the most given that scenario and who would benefit the most. And will we be doing harm or no harm? So some people might need the ventilator, some people won't. Who will have the better quality of life? Who has the best survival chance? So by having these ethical principles in place, we can go about it in a very clear, organized manner. So the discussion is about fair, equitable, and good resource allocation, prioritizing based on the patient's needs, holistic needs as well. Confidentiality. So a teenager, so many of you might have come across confidentiality, Gillick competence, Fraser guidelines. So Gillick competence is a concept that an individual under the age of 16 can be competent if they can understand, retain, weigh up, and communicate. There isn't a lower limit for the age, but normally it's around 10 years, 11 years old, and they can have healthcare consultations if deemed by the medical professional that they're able to and Gillick competent by themselves. So a teenager might reveal something potentially harmful or dangerous to you, but asks you not to, tell their parents. As a human, you might think, oh, I need to tell their parents because they might have no understanding. But we need to take into account all these principles. When is it okay to break confidentiality? Is it ever okay to break confidentiality? And yes, there is sometimes. If patient life's at risk, if the life at risk to others, it's a legal case, a police case, then we may think about breaking confidentiality. But when doing that, we need to let the patient know. So we need to think about autonomy, beneficence, confidentiality, patient's capacity, and balancing patient's trust with the duty to protect. Our job as future healthcare professionals, is to keep patient safety, maintain their trust, and make sure that healthcare is always an accessible place for them. Empathy. We always use the empathy word. But what is empathy? Do we show empathy? Do people experience empathy? Empathy and sympathy are different things. Empathy is all about putting yourselves in another person's shoes, another person's situation, their position, trying to understand them, and importantly, in a non-judgmental manner. We need to try and understand them without making any sort of judgments. And the way we can show empathy is by saying, you can't necessarily say you understand, but you could say, I could see why this could be difficult for you. Or you could say, the patient's well-being is my priority. I can see this is a difficult situation for you. You can never truly understand someone else's position, but you can try and understand their situation. We can practice empathy through role plays. We can practice empathy through putting ourselves in situations where we just listen. Active listening is the hallmark of showing empathy. Cultural sensitivity. In the modern day NHS, so the NHS has shifted. It's not the NHS as we used to know, it's a modern day NHS with people from different backgrounds, social situations, and people from ethical minorities. So you might be faced with ethical dilemmas across various cultures. So in many cultures, there's a family involvement, there's a religious involvement, there's a cultural component. And when we're discussing these situations, we have to respect cultural belief while adhering to ethical principles. So always refer to good medical practice, always refer to the GMC guidelines. So what are some tips for ethical scenarios? Stay neutral. That doesn't mean on the fence. It means have a conclusion, but provide balanced arguments. Some discussion points for, some discussion points against, but try and conclude your answers with the ethical principles in mind. Have good time management skills. Use a structured approach. If possible, link it to your own prior learning, your work experience, your kind of exposure, but address the question. If you have any doubts, please express, I don't understand. Can you re-clarify the situation? And if you're not able to formulate an answer, practice showing what you're thinking about. That's in itself a good hallmark of good communication. That's really important. The GMC domains. So the GMC domains relating to medical ethics, you've got domain 1, knowledge, skills, and performance. So the ethical link, doctors must be competent, maintain up-to-date knowledge of medical practice. Safety and quality, so non-maleficence always. Doctors need to take appropriate steps to safeguard their patients. raising concerns where needed. Communication, partnership, and teamwork. Effective communication and respect to patients' autonomy, as well as working with other healthcare professionals, is really important. And maintaining trust. This is incredibly important, okay? We always want to maintain trust with our healthcare colleagues and with the patients, and these reflect the core value of the 4 pillars. So we also need to talk about NHS values. So the NHS values we think about are respect and dignity, compassion, improving lives, working together for patients, and everyone counts. So we don't just state the values, we need to talk about the relevance of it. And we should talk about NHS values linked with the 4 pillars, linked with the situation in hand. That shows a well-rounded, holistic answer. Conclusion. When talking about ethical frameworks and ethics, have a framework, guide decision making, but it must be balanced with real world examples if you can. So this is where your further reading really helps. Practice regularly. The more you practice, the more comfortable you'll be with these scenarios. You don't need to know the exact ethics, but you need to have a good approach. Please stay informed. Read BBC articles, read PubMed, read the NHS websites. Just know what's going on and try and refer to them. Tip, always reflect on how your decision impacts the patient and wider society and how it impacts them in a holistic sense. Always link back to the 4 pillars, NHS values, and good medical practice, and you should be good to go with your ethical scenarios. Hopefully, you all get to practice this today. Thank you.
Thank you, Abhi. A sincere apologies for the delay. We are 15 minutes late, but we hopefully we will be on time next week. What I'm going to do is we are going to break it into meeting rooms. I will request the tutors to go to your direct respective meeting rooms, and we will allocate students to those rooms where you will have the opportunity to discuss one-to-one in a small groups of 3 or 4. Okay. Sorry, there might be a slight delay. Just bear with us. Priya, do you want to open the meeting rooms? Thank you.
Yes, bear with me just one moment.
And we will also be sending the recording. If people join late today, whatever we discussed in the first 15 minutes, we will send you a YouTube recording by next weekend. So don't worry if you are late. And we'll finish on time at 6:30.